Now we are going to speak about the process of bone healing. So in speaking about process of bone healing, to speak about a fractured bone from another bone. Is it clear? You have another bone which is normal. Is it clear? So you should speak about first the anatomy of that normal bone. In a normal bone, you need to know that the inner side, you have an inner side of the bone. Is it clear? And then you have the outer side of the bone. Is it clear? And then the middle is the bony or the compacted bone in the middle. Is it clear? You have the compact bone in the middle. Now you need to know that the bony types, you have two major bony types. You have the spongy bone and you have the compact bone, as you have said for the histologic. Is it clear? Now the compact bone is located in the middle. Now at the level of the inner side and at the level of the outer side, you are going to have the spongy or the cancellous bone, which are less compact. Basically, now in the middle here you have what is called the bony hematoma. Basically, in the middle you have what is called the bony hematoma. Now the bony hematoma is what comes out, is it clear, in a case where you have a fracture. So when you have somebody that has a fracture, that bony hematoma comes out into this space here to cover up this space, is it clear, where you have a fracture. Is it clear? So it cover up this space in order to start wound healing. So you first have a break of the bone. After you have a break of the bone, you have a formation of a bone hematoma. Is it accumulation of bone hematoma at the level of the fracture site. Is it clear? Now you need to know that what, when the inner side of the cancellous bone, that inner side of that cancellous bone that is inside here, as it goes out, it's going out with the bone hematoma. Is it clear? And that inner side is made up of the osteoblasts. Is it clear? It's made up of osteoblasts, much of the osteoblasts. Now later on, you see that you're going to have still a bone like this, and then you're going to have the formation of a soft callus at that position there. Is it clear? The soft callus is because of the connective tissue formation proliferation by the osteoblast. So you're going to have a soft callus which is going to be formed at that level. Is it clear? Soft callus is going to be formed by that level. Is it clear? As a result of the osteoblast proliferative action. Is it clear? Now, after the osteoblasts have proliferated, the next thing is that what you still have that bone. Is it clear? You are now going to have calcification. Is it clear? That is the bone hematoma. Now you are going to have calcification of that soft callus. Is it clear? You are going to have calcification of that soft callus still by the osteoblast. Is it clear? The osteoblasts are still going to calcify the soft callus. And now in this case, the osteoblasts are best called the osteocytes because they are calcifying and they are entering into the lacuna to stay inside the bone. Is it clear? So the osteoblasts, you can see best call them osteocytes at this level when they are calcifying. Is it clear? So they are the one calcifying now the bone to produce what is called the hard callus. Is it clear? Now you need to know that when there is formation of hard callus, the next element is that what you have still the bone. What happens is that that hard callus may want to proliferate out of the borders of the bone. Is it clear? The hard callus is going to be produced and is proliferating out of the borders of the bone. Is it clear? So everything that is done in excess is not as it's not as strong as when it's supposed to be done in a fine-tuned manner. Now there is where now you need to know that there is another part that was seen in the external part. Is it clear? You need to know that there is a periosteum on the external aspect of the bone. Is it clear? And that periosteum on the external aspect of the bone contain osteoclasts. Is it clear? Contain osteoclasts. So when there is excessive proliferation of the hard callus out of the bone, the osteoclast now gets activated, and the osteoclast gets now in the form is going to remove. It's going to function in remodeling. Is it clear? In remodeling now, is going to place back the hard callus into a normal location for the normal bone to get formed. Is it clear? So when it removes all this excessive hard callus such that the hard callus gets only inside the normal position to produce back the normal bone. Is it clear? That is the end of the process of bone healing. Is it clear? So those are the different elements that you have to understand in bone healing. So at the beginning, you have the bony hematoma that goes out and goes at the level of the fracture site. Then you have osteoblast, which goes out with the bony hematoma to produce a soft callus with excessive proliferation. Then you are going to have the hard callus that's going to be produced as a level of the osteocyte or the osteoblast when there is calcification. And later on, you're going to have the osteoblast that acts now to remodel the bone such that the bone now should be fine-tuned in a particular direction for it to become back the normal bone. So that is the process of bone healing, basically. Now, where are the hinders now of open fracture? Between closed fractures and open fracture, which one is bad? It is open fracture, and there are two reasons why open fracture is bad. The first reason, which is the most important reason why open fracture is bad, is that it communicates with the environment. It means that it can highly be infected. So open fracture can get infection from the external environment. Are you getting? So when you're getting infection from external environment, it's the open fracture. Now the next point is that what? Also, when you have open fracture, you have communication of the bony hematomas out. It means that normally the process of bone healing, the bone hematoma is the one that starts the process of bone healing. Just imagine that all that bone hematoma that was supposed to be at the level of the site of the fracture, it is all lost in the external environment. You see that there is no start of bone healing. So in this case, you're in open fracture. That's why open fracture is usually associated with cases like non-union. Is it clear? And I'm going to define what is non-union later on. Now, another element in open fracture is that when you have open fracture, you have also what is called periosteal stripping. It means that the osteoclast can be removed. Is it clear? And when you have the osteoclast that is removed, you can have union hypertrophic hard callus that is going to be produced. And when you have the hypertrophic hard callus produced, it can produce what is called a hypertrophic non-union. It is going to be united but in a hypertrophic way. Is it clear? Those are the things that you have to understand with open fracture. And that's where the whole of bone healing works. So in order for you to know all the factors that affect the bone healing, go back to your tutorial on wound healing and you will see all those factors associated with wound healing are also associated with bone healing. In addition to those factors, you have immobilization and mobilization with calcium. So we have calcium, immobilization, and mobilization. Those are the three major factors associated with bone healing, specifically associated with bone healing. All the other factors that we have seen in wound healing is going to be applied here, like the technique of the surgeon that is being used for open reduction. If you use a poor technique where you're supposed to do internal reduction, you're supposed to do a surgery, you instead do conservative or external restriction, that is also a poor technique. Is going to unfavor the bone healing. So you can have the technique of the surgeon that is used that unfavor the bone healing, and you have other normal medical condition. And the normal medical condition, we say that you have the JAMS VASC, G for jaundice, A for anemia. So go back and see that on wound healing. Now the specific one which are involved here in bone healing is this fact of immobilization and mobilization. And why is this specifically involved here? Because immobilization needs to be done when the soft callus is produced. Is it clear? Because by the time of soft callus, the bone is not yet hard. Just imagine you start mobilizing at that time. All the soft callus that is produced is going to get bad. Is it clear? And then you are going to start back the process of bone formation. And mobilization get to be produced at the point of time where the hard callus get to be produced. Because when the hard callus get to be produced, you need to mobilize so that it should not get hypertrophied. Because if it get hypertrophied, it's going to also and is occurring at the level of a joint. If it gets hypertrophied, you are going to have ankylosis of a joint, redness. Is it clear? The joint is going to become more stiff, or that part of the body is going to become more stiff, or there's also going to be non-union. Is it clear? So in case of the formation of hard callus, you need to now start mobilization, but the mobilization should not be excessive. The mobilization there, the role is to reduce the overproduction of the hard callus. Are you understanding? So those are the different elements associated with the process of bone healing and their relevance.